Good afternoon to you all. Welcome to Pertinent Question. That's the program. The station is Western Spring Television, Agumbelewo Shobo. I happen to be your host, your regular Monday afternoon host. I am Adeto Eshitu Alamo. What do we want to know today? We are going to discuss something that touches you, health. Health. And they say it is wealth. This Monday, we are focusing on public health. What is the quality of that aspect of our healthcare delivery in Nigeria? That is what we will find answers to in the next 45 minutes or so, when I will have the privilege of being your host and welcoming you into your own home where you live. My guest is a medical doctor who combines that in his private hospital with teaching in the university. As a matter of fact, he is currently the head of department public health over there at Redeemers University in Ede. Today, he has moved slightly from being an administrator, from being a medical practitioner, and into what we can call public health. He would explain all that because it's an area that many people get confused. What aspect of medicine is public health and things like that? He would explain them all. He's somebody you know, a very erudite speaker and scholar. Dr. Adeniyi Samuel Ogini, that's the full name. Many simply know him as Dr. Niyi Ogini.
Yeah.
Dr. Niyi Ogini. But I would like to know, because I know him very closely, is Dr. Adeniyi Samuel Ogini. You are most welcome to the program.
Thank you very much, sir, for having me.
You came here over 15 months ago when you were in service, as a matter of fact, almost exiting as the executive secretary of TACA.
Yes.
You have moved on after that pertinent question encounter with us.
Yeah.
You have gone on to retirement. You have gone back to your medical practice. Today you are a teacher, and not just a teacher at the university. You are the head of department of
Public health.
public health. Now, again, I will say welcome.
Thank you very much, sir, once again.
My first question, what is public health?
Thank you very much. Public health, we can simply define public health as the science and practice of protecting and improving the health of groups of people by promoting healthy lifestyles, preventing diseases and injuries, and ensuring there's community well-being through collective action and public policy. You can see the key things here. We're talking about we are protecting and improving health, not of individuals, but of groups of people, and then we are also, doing that through, promoting healthy lifestyles amongst them to prevent disease and injuries through their own, community action. It's community action and public policy. This is the high point. Those are the differentiating things of public health from, clinical medicine.
Okay.
You understand? So we focus on populations, not on individuals. We also target healthy lifestyles. We are prevention oriented rather than curative, you understand? And then we do it through collective action and public policy. As we go on, I will explain all of that.
So if I can get you from this very outset,
Yes.
one does not necessarily have to be a medical.
Oh, doctor, I mean, the medical doctors, there are few even in the practice of public health. The public health is, one section or one unit in the health sector that embraces everybody. Whether you're a biochemist or you're a chemist or you're a geologist or you're a health educator, you are a nurse, you are a pharmacist, there is a role for you to play in public health. Remember, what we're talking about public health is we are educating people to promote healthy lifestyles, to prevent diseases and injuries, and then we're doing it through their own collective action and public policy. So that once you're able to achieve this, we are actually having a healthy population and a healthy environment.
Okay. Let me take you back a little. Before one can become a public health
Practitioner, you mean? Okay.
Practitioner, not
Yes,
physician.
not physician. A physician is just one, aspect. It's just one specialization in public health.
Okay.
Yes.
Before you can become a public health practitioner, as a secondary school student, what must you aim at?
Yeah, you see, all you need to aim at is just like every other person goes to the university. You go to the university to obtain a degree in public health. We call it the Bachelor of Science in Public Health. Initially, I mean, when I did public health some 25, years ago, I mean, as my master's, I'm first a medical doctor, and then I went to do specialize in public health. I was actually, given a scholarship by the World Health Organization to do public health. Now, but in the last 20, 15, 18 years, it has already been accepted by the Nigerian, Universities Commission that public health be taught at the undergraduate level. It used to be a graduate course, but now it's at undergraduate level. So if you have your 5, credits, you can, and then you pass your JAMB, you can go in to study public health. You can choose public health in the universities. Many of the universities now offer public health as an undergraduate course. So that's all you need, 5 credits, and then of course you must have a good score in your JAMB, and then you are in.
That's how the difference comes in, the difference between the public health physician and the public health practitioner.
Thank you very much. So public health, like I say, is a wide field that brings in so many people. We have public health nurses who are initially nurses. They qualify as nurses, and then they go to do a graduate course in public health. Now we have public health physicians like myself who are doctors. We are medical doctors, medically qualified, and then we choose to specialize in public health. So we call them public health physicians or community physicians. That's who we are. So you don't have to be a medical doctor before you can be a public health practitioner.
I'm interested in it, doctor.
Yes, sir.
So can I become a journalist?
Public health journalist.
Yes.
Can
I become?
Auntie Moji Makanjola?
Yeah.
She's making waves all over the world.
Not only waves.
Yes.
She's making money too.
She's making, of course, when you're making waves, you're making money. I still spoke with her yesterday.
Okay.
She is one journalist that has come into the public health space, and she's ruling her world in public health, from journalism. Because, you see, communication is key in public health. You communicate to people, you educate them. You also, communicate even strategies for behavioral change, because these are all strategies that are involved in ensuring healthy lifestyles, which is one of the things that we promote in, public health. So, journalists have a big role to play in public health.
If I should come in on anybody who is not from the medical, not even a nurse, comes in, would we be qualified to be addressed as belonging to the medical team?
Not medical team. You see, this is the problem that we have had for a very long time. You see, when you talk about medical, other professionals in the health sector become angry because the health sector is not medical alone. The health sector is a system, and the way we define a system is that a system is a collection of several units working together in order to ensure that, each of those units are functioning in their own way to achieve a goal, an objective, a set objective. So such that if any one of those units refuse to function appropriately, that, system will not achieve its own goal. So it's a collection of people. So when you now emphasize or you overemphasize just one unit or one component of that system, the others will believe that you have relegated them, you have belittled them, and as a result of that, they might not cooperate to achieve. And that is the bane of Nigeria's health sector today. So we don't call medical. In fact, you see new colleges of health sciences now, where they train doctors, they no longer call them College of Medicine, like you have in, UCH. Now, I went to IFE, I graduated in 1989. Ours is a Faculty of Health Sciences. So in health sciences, you bring all kind of people that are in the health sector. That way we're able to work together as, people in a team. realizing the importance of each one of us and giving respect to them.
The quality of public health practice in Nigeria.
Yeah.
You have been in the field for over 25 years.
Yeah.
How would you assess it?
Well, the truth is that the quality of public health practice in Nigeria is still very, very low. Very, very low, because the health administrators, either because they do not have a good understanding of the role of public health in, health outcomes, have not really given it the priority that it should have. In fact, some other people even believe that, you don't even need to train, people at undergraduate level in public health, because they believe that, look, you're either a doctor, a nurse, or you are a pharmacist or something in the health sector. But beyond all of this, we need people who can work towards ensuring that there is harmony and there's unity, amongst the various units that work in the health sector. And aside from that, we need also people who will be preventive oriented through health education, through environmental control and management, through other means, to ensure that we live in a healthy environment. And a lot of this, depends on the public health practitioners. So, but this has been downplayed. In fact, even in the federal, scheme of service, federal civil service scheme of service, you would not see anywhere they're putting graduates in public health. However, they will say, graduate in any, health-related course. But they can mention nurses, they can mention, but they would not mention public health itself. And this is one thing we're going to be working towards, working together with Nigerian Universities Commission to ensure that there is, a modification of the entry requirement into some of those cadres in the health sector that will specify public health graduates. These are all of the things that's affecting, because even people are not coming in there because they do not see a particular, a role that there's no place for them in the federal scheme of service. I was going through the federal scheme of service. You have scientific officers, you have population program officers. All of these are places where, public health graduates can work and do very well. You understand? But not many people know. So we are still going to continue with our sensitization to ensure that people know what public health is and they give it the right place in the health sector.
I'm appreciative of what you have just said.
Yeah.
In your answer, you spoke about the need for harmony.
Yes.
Apart from the effort that people like you are going to make at the university commission level,
Yeah.
what other things can be done to ensure that this harmony you spoke of
Yeah.
becomes the official practice amongst healthcare?
I was the chairman of all the doctors in the civil service between 2006 and 2008.
Supposedly a troublemaker.
Oh, yes. I'm a troublemaker. I make trouble for people who don't want to do good things. And then, I became also the chairman of all the doctors in Osun State between 2008 and 2010. And I was a chairman of all the doctors in southwestern Nigeria, 2008, 2010, And my epistle, the gospel I always preach, is that until and unless there is unity and harmony in the health sector, our health outcomes will always be bad. Now, government has spent billions and billions on our health sector, but our health outcomes have not improved really significantly.
Why?
So this simple reason is because people are working across purposes. There is no harmony. And that's why I said that health administrators must come out to let everybody in the sector know that they are very important. The nurse is important. The doctor is important. The cleaner is important. We are talking about how can we ensure this harmony in the sector. It starts from even when they are training. In times past, when the nurse is being trained, they tell the nurse, don't think that, don't see the doctor as your boss. The doctor is not your boss. The matron is your boss. And so when you get to the hospital, you treat him as such. You understand? Now, at the university, we have nursing students, we have medical laboratory science students in our faculty of basic medical science in the university. And I called nurses and I called them. I said, do you know something? The doctors and the nurses are primary culprits in the disharmony in the health sector. And I tell them, if you want to prevent that, you people that are training now, I wouldn't want you to go with that mindset that, oh, the doctor is not your boss, and you come, with a fixated mind to begin to fight in the health sector. You won't achieve the result. Yes, there is no boss, so to say, but there is a leader. There is a leader, and the leader leads. the leader should not look down on all the people that are
And who is the leader here?
The leader in the health sector is obviously the medical doctor. The simple reason is by virtue of his training, by virtue of his job, designation, by virtue of, the, how do I say it, the practice itself. He can do a bit of nursing, a bit of pharmacy, a bit of medical lab sciences. He does all of that combined. That is why he is the natural leader of the system. But when you talk about head and tail, that is where problems come. A leader is somebody that galvanizes other people to be able to achieve a particular purpose. And is doing it not by coercing or forcing them. He's able to get them to do it and do it happily. Most of the time, the lack of emotional intelligence amongst we doctors first, that's one of the things that cause problem. Many of our doctors do not have emotional intelligence. They have high quality, cognitive intelligence, but the emotional intelligence is not very there. And that's why relating with others has been the problem. And this is what has caused problem for us in the health sector. And the nurses also have followed suit. So it's everybody is saying, I'm on my own. Yeah. I'm on my own. How then can we achieve organizational goal?
The leader.
Yeah.
The head.
Yeah.
I think it's only semantics.
It's a matter of semantics, but you see, people respond to these things differently. If I say, I'm your head, you may feel a bit, but if I say, I'm your leader, it might be, you might accept being, the leadership issue than the headship. Particularly when it comes to area of working and then there are remunerations that involve their positions to be shared. When you say, I'm your head, people just develop ears and it becomes a problem. You understand?
A young doctor.
Yeah.
I'm giving you this scenario.
Yeah.
Young doctor, 5 years old in the job. A matron who has almost seen it all.
Who is the leader?
Who is the head and who is the leader?
Thank you. Hospitals are headed by doctors. Sir, if you are ill and you want to go to a hospital, they say this is the hospital, and you go to the hospital, who are you going to ask for?
Doctor.
Why would you ask for the doctor?
Because he's supposed to treat me.
That's it. That's it. You see,
but
ask for the doctor.
He doesn't treat me alone.
It does. Thank you. That's why the doctor must now respect every other person that is in that team that makes his work easy and that makes his goals achievable. But this is where the doctors lack the emotional intelligence, like I said to you. Many years, passed. You see, you just feel, I'm your head. And it's like a husband and a wife at home. Who doesn't know who is the head in the family? Yeah. But when the husband can say, look, don't you know that I'm your head in this family? Don't you know that I'm your head? There's a problem already. You understand? So it's not something that you need to rub in, but it's something that you need to command. I tell my doctors, I said, your superior certificate does not confer on you any superiority. What confers superiority on you is your superior knowledge and competencies. Now, you said something. Let me tell you something. When I joined the civil service, I had a matron that has been in the hospital for many years before I joined the civil service. And I was just 5 years into practice when I joined the civil service. And this woman will come and change my prescription and everything. And I had to send her to the hospital management board for them to warn her to stop that. Because regardless of how many years she has spent in the sector or in the hospital, I am the head of that hospital.
At that time, you're head.
I'm the head of the hospital, and it should respect my opinion. If you want to change anything I've said, consult me. And then, of course, the doctor also should make himself available and approachable. You don't know it all. The doctors don't know it all. And we must see it as such. That's why I'm talking about emotional intelligence and how we can make the system work better. Thank you.
Yes, I'm coming back to the health practitioner. His role in health delivery.
Yeah.
I want you to do that separation.
Yes, the public health practitioner is not a doctor. But the public health worker, that's a graduate public health worker, is one who is involved. First, there are different aspects of, public health. We talk about, environmental health. The environmental health aspect, they work together with sanitation officers to ensure that our environment is healthy, to prevent diseases. So that's part of the role of the public health officer. Now, again, they are about statisticians. They are people that work, like I told you, they are scientific officers And then there are statistical officers, there are data officers also in health data officers. Aside from health information officers, there are people also that, conduct researches to ensure that they're able to understand the current situation in the health sector and develop, improvements, strategies for improvement. There are people also who work in epidemiology. Epidemiology is all about determinants and distribution of disease. So they do a lot of research to ensure that they know what is causing the disease, where is it happening, who is it happening to, why is it happening, and then they now develop strategies for prevention. This is the key, the core work of public health workers in the hospital. They're also involved in health education. They go into community to carry out community interventions. These are all actions, activities of the public health worker. And if the public health sector is given, in the health sector, if the public health unit is given its place of pride, you will discover that less people will need to go to the hospital, because most of the things that bring them to the hospital are in the environment. They are in what they eat. They are in the way they live their lives. So once you have taught them healthy lifestyles, you have made the environment sanitary and everything, so less people are going to the hospital. So that is why public health must give importance and relevance.
Why is government,
yes,
why are they not latching up?
Thank you very much. You see, they do. You see, sometimes government becomes hypocritical. The truth is that the World Health Organization brings money. All development organizations bring money. All the money they are bringing is for public health interventions. Okay. They will grab this money, corner the money. But then rather than now
misappropriate it.
Of course, our misappropriation is the order of the day. And you heard what happened recently when Donald Trump was doing his investigations about USAID and all of the health sector interventions that he said they were involved in. You see, they were diverting money of health sector interventions to other things that are quite contrary and inimical to our progress. But let that be. What I'm trying to say here is that the people who ought to know and not knowing, they would rather take all the advantage of the monies that come into public health and not look into the rudimentary, aspects of ensuring that we train a good crop of public health practitioners that can work in all of these, different aspects of public health to ensure that we have a healthy environment and we have a healthy population and we have good health outcomes from all our clinical interventions. So what it requires is someone that's passionate. Like we had Olikwe Ransom Kuti, the professor of blessed memory. He came in and he immediately, the period he was there as Minister of Health, things change. At the grassroots. Yeah, for 8 years. And things change. At the grassroots, you had more, health access. People at the grassroots could feel the presence because they trained lower cadre health workers, the community health extension workers, community health officers who could go into the community and improve the life of the people. Thank you.
Well, we will be back. He's a smooth talker, and Dr. Adeniyi Samuel Ogene, Head of Department
Public
Health, Redeemers University, Ede. We are halfway through. There will be a break simply to make up. The second part of it, we will look at some other issues. We have focused more on public health because that is the topic we are treating today. We will be back in a jiffy. Please wait for us.
Fumilayo Ransom Kuti was an educationist and advocate of women's rights. She was recognized for her vitriolic comments against colonial policy of taxation as it affected the Nigerian women. Bere, as fondly addressed by her women followers, Fumilayo championed the initiation of universal adult suffrage, which gave an unprecedented leeway for women to contest elective offices and power to exercise voting rights. Married to a foremost educationist and teacher, Israel Oladotun Ransom Kuti, the first president of Nigeria Union of Teachers, Fumilayo Ransom Kuti was the mother of children who inherited her spirit of activism. Olufela Ande Ololari, the former, a renowned musical legend. She was the first female student of Abeokuta Grammar School and the first female to own and drive a car in Nigeria. the award recipient of Member of Order of Nigeria MON and Lenin Peace Prize, was born 25th October 1900 and was killed on 13th April 1978 by rampaging road soldiers in Lagos. Western Spring Television identifies Fumilayo Ransom Kuti as a watershed character in history. Dramatist, playwright, and icon of Yoruba thematic arts, Duro Ladipo was born December 18, 1931 in Osogbo, southwest Nigeria. His clergyman father christened him Timothy. His other names, Duro Dola, Duro Shomo, Duro Orike, reflected his personal and the circumstances that surrounded his birth. The legendary stage actor had in several public fora identified himself as one of the greatest abikus born to die in this world. Family records reveal how he was born and died 13 times. The intertwining names he bore thus lent credence to his spiritism. Duro Ladipo was one of the best known and world-acclaimed Yoruba dramatists to emerge from post-colonial Africa. His notable works Obakoso, Obawaja and Moremi took him beyond Africa to several parts of the world. By the time Duro Ladipo died on 11 March 1978, the Nigeria's first cultural ambassador had acquired a towering image as an artist whose works adorned the frontage of Trenchard Hall, University of Ibadan. Western Spring Television identifies Duro Ladipo as a major character in history.
Welcome back to Pertinent Questions, that is hosting a vibrant young man who has grown old. He's now in his 60s.
Yeah.
Dr. Adeniyi Ogini, Head of Department
Public
Health, Redeemers University. My first question in this second half of our presentation would try to strike the dichotomy between who you are, a medical practitioner that we need, an administrator,
Yeah.
and now back to the
University as a lecturer.
What has been your experience so far?
Well, I thank God for the trajectory of my professional life. Started just as a medical officer, and then by divine providence, I gained a fellowship of the World Health Organization to study public health, which I did successfully, and then I went on to do a PhD in environment. I have a PhD in ecology and environmental science, which qualifies me to lecture in the university. And of course, I still have my practice, so I enjoy the medical practice. But more than that, I enjoy teaching and impacting the next generation. And then I enjoy the field of public health more than any other field in the health sector, more than any other specialty in medicine, because in public health, you have the opportunity to impact on the lives of millions of people by just one policy. And I've done that in this country. The Basic Care Provision Fund in this country, which is Nigeria's flagship program for health financing. I was privileged by the grace of God to be one of the people that drafted the operational guideline that's still being used today, affecting over 250 million people. Now, you won't do that in your clinic. So I'm a fulfilled person in the practice of public health because I have had opportunities to bring policies that will affect lives of people. Of course, health insurance in Osun State is also one of it. I'm affecting millions of people. I'm the pioneer executive secretary of health insurance in Osun State, and I established an agency that within 2 years was a talk of the town and a talk of the nation. And within 2 years, we became the third position in health insurance practice at the state level in the country. And then, of course, I left a legacy before I retired from the service, which is still there speaking.
We will come to that in the tail end. What challenge or compare public health or your teaching, what you do now, this your what you do now.
Yeah, as a teacher in the university.
Compare it with the ones you did as a physician or a doctor, a medical practitioner, and an administrator?
Oh, well, it's just that now I have more, time devoted to teaching. I have always taught, even as a executive secretary of health insurance, I developed all of the processes and the protocols that are being used. I teach my directors, I teach my staff on a daily basis. So I have a passion for teaching. And of course, what I taught them, I believe that if they're still using, would live with them for the rest of their lives. And as a clinician, of course, I taught also my staff in the hospital, my clinical staff, the nurses that work with me and others that work with me. I also taught them because it's natural. Of course, I learned from them as well. So it's a even as a lecturer now, I'm still learning from my students. As I teach them, I also learn some things from them. So it's a continuous life of teaching. It's just that the roles change, but the teaching still, is there. And of course, I'm enjoying every bit of it.
What challenge or challenges does this country face, this nation face in healthcare delivery? I know you have mentioned one, which is the challenge.
Disharmony, yes,
the disharmony,
in the sector. The other challenge is the challenge of every other sector of Nigerian, nation, and that is corruption. It's a big challenge. Corruption perverts everything that is good, and corruption makes a mockery, or it makes a mess of very sound and good policies. You can make the policies, you can have them well articulated on paper, but when there is corruption, the implementation becomes warped, and you never get the result that you desire from those policies. So the biggest challenge to our development, to our achieving the goals, particularly in the health sector, is nothing else also than corruption, which is evident in so many other aspects of our human life as a nation.
This is very challenging. You've placed corruption as the major issue.
Yeah.
From your experience as an administrator, as a medical practitioner, now as a public health lecturer, physician, all rolled into
everything.
one.
Yeah.
What is the way out? How can we stem this challenge? It's a big challenge. It permits the entire
Number
nation.
one is putting round pegs in round holes. Competence is very important. But beyond competence, character. Character is very important. You need people that are upright. You need people that are transparent. You need people that have integrity. So if you do not have integrity, no matter what level of competence you have, it's going to turn you into a monster. You are not going to be useful to the people because you'll be thinking about yourself and yourself alone. And that is what we have in the service, that this nation is not making progress because people who have been put at the end of affairs, particularly in the civil service, are seeing every position they're occupying as an opportunity to, for public, personal aggrandizement. They are not seeing it as a position that God has put them to impact the lives of people, but they see it as this is a position where we must grab everything that we can grab. And
this is our time.
This is our time, so let us grab. And of course, the psyche of the people, even the followers, are such that, look, if you don't take it during your own time, let me tell you, some people came to meet me, they say, you see now, you are mad. You see, when you had an opportunity, you were sitting over billions. You handed over billions when you left office. You didn't even help yourself to some of them. Now they have blown the money that you put together. Don't you think you are stupid leaving this money? I said, I'm not stupid. I wasn't stupid. I got all the benefits that accrued to me normally, that were legal and official benefits as executive secretary, and I thank God for it. Our greed is the problem that we have in Nigeria. If it's not for greed, what should you be asking for? I had an official vehicle, I was given other allowances and things like that. But our people will say, okay, if this contract is 40 million, use 10 million to execute the contract and let us share 30 million. If a contract is valued at 40 million and you want to execute it with 10 million, don't you know that you have already finished it? In fact, some people say, who told you to execute contract? Just write it, and the people that will come and inspect it, you will give them money. They are accountant general, auditor general, everybody that's supposed to do everything, you will settle everybody. So at the end of the day, settle them, and they will say the project has been done, even when you have not raised anything. This is where what brought us to where we are today. So, but until and unless we have people who are ready to serve and people who will put in place positions, people who will not be serving their own interest, but the interest of the general good, that is the only time we are going to have, the solution. That's when we are going to make progress. This country, we have the resources, but then our mindset is warped, and that's warped towards corruption. If we change that, we'll get,
How do we change it?
Well, we change it by, how do I say it? Well, identifying the people. There are still people that they are very honest Nigerians.
Yes.
There are very honest Nigerians that are also competent. But you see, the order of the day is they have sacrificed merit for, mediocrity and for settlement. You understand? So you can put an idiot somewhere, so long as he can be settling you, bringing it against to you. But if you put somebody who knows what he is doing, you can be sure that you're not going to get the kind of things you want to get. And that is the issue. So if we now get people who are interested in national development above their own personal growth and development, then we'll begin to have people emerge in places where they can make, significant impact to make, to improve our system and our lives. Yeah.
It is said that you can't judge a book by its
Cover. Yeah.
An average Nigerian, how do you identify them when they are looking for the job?
You see, there are usually background checks that people do. Before you place someone somewhere, you do a background check on the person. What is this person's antecedents? What is this person's, in different scenarios, how are this person carried himself or herself? Does this person have what it takes, the character it takes to deliver, even though he has the competence, he has the certificates and everything, but does this person have the character? Is he a selfless person? Is this person someone that has integrity? Is this somebody that has empathy, that would think, I'm supposed to use this money for 100 people and I want to, just appropriate it to myself? Is this someone that's conscientious? This, you can find them out. There are many in this country. It's just that, you see, the people who are in the position to choose would rather not choose just
that's
people.
where I was coming to. If the leadership that wants to bring that, to fill that gap, they are not interested in a man who is full of integrity, what happens?
Well, we will continue to wallow in the dark, and I don't know when we're going to come out. Let me tell you about my appointment. When I was appointed Executive Secretary of Health Insurance Agency to go and start an agency that never existed. When they announced it on the radio, people who heard it said, "Are you sure this is Dr. Oginidiaba?" And when they told me, I said, "No, it can't be me." Because, of course, I am not somebody...
You mean you didn't have an idea?
I wasn't told anything.
Did you apply?
No, I applied as a permanent secretary, in the civil service. When we applied, for permanent secretaryship, I applied in 2012. Only 3 of us passed. Myself and 2 other medical doctors passed, the interview in 2012. But the 2 of them were appointed permanent secretaries. I was not appointed. And when they went to ask them, why was this man not appointed? They said, this man is eminently qualified, but is utterly unsuitable. Eminently qualified, but utterly unsuitable. The unsuitability was for the manipulations which they know I would never. But that same government, at the twilight of its administration, appointed me as executive secretary to establish an agency that never existed. You understand? And that showed that they know when they want to have results, they know who to put where. And the results became very evident in the whole of the state. You never heard about OIS. Within 2 years, OIS was everywhere. It was all over the nation. People were benefiting from it. Today, it's a different story. But I have already left, the landmark there.
What do you mean by it's a different story?
Well, because, you see, so much noise that people come to my clinic all the time to complain about the fact that, where they have their health insurance, they give them paracetamol only. And then I said, well, I don't have anything to do with health insurance anymore.
I would say
I am on my own.
That is or was to massage your own ego.
Oh, well.
From them, I mean.
No, they come.
You have done well. They want to continue to tell you have done well.
No, not just that. It's painful to them because they come to pay in my clinic. They come to pay money. Ordinarily, they wouldn't have been paying if, what they are supposed to get from the health insurance they were getting.
But let me go a little extra.
Yes.
There was a time that they announced, the system announced that your clinic is no longer
part of yes, that's correct.
So if people come there, they must pay.
No, you see, the people kept coming because that was where they chose. They chose that hospital, and nobody has told them that this hospital has done anything that they should not patronize it for.
But
so
your
the
name
people,
had been blacklisted.
of course, they removed the name, so they removed the hospital, and so when they come and I'll tell them, sorry, your name has been removed.
So you must pay.
Oh, so you must pay. And they say no, but I said go back and tell them. If you have, health insurance is a matter of choice. You choose where you want to, receive something. And if they have chosen my hospital and it has been removed, it is a violation of their rights. So they should go and tell them back. When they went, they said, oh, Ogini is instigating people against health insurance.
So it means you since you left, there hasn't been a good harmony between yourself and
no, I don't have any. No, I have a lot. Oh, all my staff there, we still relate very well. The system is different from the individuals. I had personal relationship with every of my staff, including the gate man.
Including your successor?
Well, my successor was not there when I was there.
Okay.
So it was brought, from outside.
I can understand.
Some of my some of the people that have been there when we were working together, we still have our very good relationship. Yeah. You understand? But with some other people, of course, there's no relationship because even while I was there, we didn't have a good relationship because we were always fighting. We were fighting because
you have always been known
they wanted something which I didn't want them to have.
Always been known to be a fighter.
Oh, yes. I don't have any apologies about that. I fight for the right things. And
why do you think, is it why? Why do you think of the shenanigans that came your way at the tail end of your career? Maybe
my last 6 months in the health insurance before I was moved.
Yes, you were suspended at a point in time. You were brought back.
No, I was actually not suspended.
That's what we had.
You know what suspension is. When a level 17 officer in the civil service is going to be suspended, it's not just an announcement on the
Doctor, that's what we heard.
You heard it, but I was going to the office every day.
You have to explain it.
No, that's what I'm telling you. I was not suspended because they announced a suspension. But then the announcement was made on the 29th of December. On the 2nd of January, I was at work. And I worked until 27th of March when I went on holiday. Normally, I go on my holiday. I have a 1 month vacation in a year, and I was going out of the country at the time. They said, "Oh, they have reverted their suspension," but then there was never any suspension because I worked until I was going on holiday. And when I came back from my holiday, I resumed on my table and I worked until I was reposted to a state agency for control of AIDS.
Yeah, that's what I'm trying to say. The shenanigans.
Yeah.
Somebody who has been doing fine.
Yeah.
And a new administration came and said, okay, let's shift him.
No, I was told that even before. They told me, even my directors who were there, they told me that, look, when a new government comes and they see the kind of money you have put in this place, they will move you away and they will put some other person there and they will take the money. So let us take our own now while we're here.
Were they not also being selfish? Those who were giving you that admission?
Of course they were. That's why I never listened. So they were my enemies till I left. That's why I told you that there are some of them that we were never together, even while I was there. Because what they were advising, I couldn't do. What they were advising is, look, let's help ourselves to whatever is here now. We can write memos, and that's what happens. They write memos, inflate the thing, take the money, share the money, and you don't need to do anything on ground. I say, I would never do that because I tell them that I'm a Christian. And what the Bible says is that whatsoever my hand finds to do, I should do it diligently, not as unto man, but as unto God, because it's of the Lord that I will receive my reward. Let a man come to me tomorrow and say, I have not done well, and he removes me. God will be the one to reward me. And that's why I will not join the multitude to do evil.
Let's look at your 7 months in Saka.
Wow, it was great.
Would you say it was the things you put in place would be said to have been very similar to what you did?
Oh, yes. Within 7 months of my getting to Saka, you can find out from the State Agency for Control of AIDS. You can get there. They had no tools to work with for years before I got there. Even despite the fact that they had been supported by World Bank for many years earlier, nothing was on ground. But when I got there, within the 7 months, I got computers for every one of them. And then all the facilities where we had our, HIV programs, we had, equipment, we had materials, we had consumables that we distributed. The pictures are there. Even they were covered by the media houses within 7 months. And then the icing of the cake was that we also started the commencement of the G7 cycle of the Global Fund. The Global Fund is another big fund that came to help, with HIV/AIDS activities in the state. It was when I got there that we started that process. We commenced it. So when I left, within 7 months, my people got instruments, equipment to work with. The various facilities that were working with us as State Agency for Control of AIDS, they had consumables, they had medicines, they had test kits done, and all of this. I mean, they were wowed. They said, "Look, if this had been the case for long, our situation would not be as it is." And even day before yesterday, one of the people called me, one of the leaders in the HIV world called me and said they are missing me. I said, well, a man will not be there forever. Now I retired and I'm enjoying my retirement. So I'm fulfilled. I was happy what I did in Saka within 7 months, and what I left in OIS is still speaking.
Yes, if you left so much in terms of legacy,
Yeah.
why do you think what happened to you happened?
Oh, you see, the issue is I'm a leftist.
Uh-huh.
I do not. I'm a non-conformist.
Uh-huh.
You see, when people talk about political correctness, I don't give a damn about political correctness, because most of the time political correctness is for you to just get warped and you get swayed from your principles. So I am not a politically correct person. I am not someone that that is a conformist. I believe that once something is good for all, you should pursue it, regardless of what it means to yourself. And that was the approach that I gave my work during my 30 years in the civil service. And the results everywhere, from Ifetedu to Ife to Onya, my legacies are still speaking in the service. They are still speaking. And then, of course, everybody that goes into Abere to the headquarters, you will see the edifice which I put there. It is all there. It's still speaking.
And the road.
And the road, God bless you. The road is there, OIS Road. I actually did the naming. I named that place. I was the one that bought the land to build that thing.
From government?
From government. We everything. We went through the Ministry of Lands. We acquired the place properly.
Not you.
No,
the
I'm
agency.
talking about agency. I'm talking about the agency. The agency bought the land. We approached. In fact, the government of the day did not say they wanted to build, a secretariat. Okay. But when a government appoints you as a technocrat, then you'll be doing that government disfavor if you don't bring all your skills and competencies to improve the outlook of that government, and which was what we did. And they said, I was over loyal to a particular administration. I said, I'm a civil servant. My 100% loyalty is to the government of the day. So, and I gave 100% loyalty. I did the work, and the work was always giving credit to the government of the day. So, of course, the people who came over didn't like me. Even while I was still working, the people that worked with me in the civil service didn't like me, and they were waiting for the day that they would have a good opportunity to get me out of the system so that they can do, so that they can do what they want to do. And I think they're having a field day. Okay. And well, I'm enjoying my own self too.
Okay, we've left the system. One last question. You are head of department
Public Health.
Public Health.
Yeah.
The Ogini we have known over the time has been a forward march person, looking forward to doing things.
Yeah.
And there are legacies to prove.
Yeah.
Tell me, in the next 5 years, how do you want to position the department?
By the grace of God, in the next 5 years, we want to make the Public Health Department of the Redeemers University one of the best in the country by focusing on researches that answer directly to the needs of the people in the public health space. And what I mean by that is that there are researches everywhere. People do all kinds of research, but researches that answer to the need of people so that we become very relevant. That's number one. Number two, also to champion the cause for the better integration of public health into the civil service, federal civil service, scheme of service. These are some of the things we are going to be doing. That would eventually create more opportunities for more people to come into public health practice. And then that would also give the government, an opportunity to have a crop of people that can be used to improve the public health of the people. And the moment we're able to improve public health, we have a healthy population. And that is what I am looking forward to, that within the next 5 years, being in the academic system, this is what we are going to be focusing. Research that is people-based, research that will bring results, not results that will just be kept on the shelf, but that will translate to policy. And then we push for the implementation of such policies for improved public health.
Dr.
Adeniji.
Adeniyi Samuel
Thank you.
Ogene,
Yes,
PhD.
Yes,
And a
PhD.
medical
Yes,
practitioner too.
MBCHB, MPH, PhD.
And also, what do you call a physician? A
Public health physician. Yeah.
I want to appreciate you
Thank you
for
very
coming
much, sir.
here.
Thank you very much, sir.
Knowing you as a good friend, if I give you 2 hours, you will be talking. The time is very much of the essence.
Yes, thank you.
I appreciate your coming, and
Thank
I
you
wish
very
you
much, sir.
very well.
Thank you very much, sir.
To the viewer at home, that has been the man. A few years ago, I used to call him a young man. Last year, he clocked 60. Today, he is over 61.
Yes, I'll be 62 in a few months. In a few months, I'll be 62.
It shall be well with you.
Thank you very much, sir.
So,
you too.
That has been our story and our package on pertinent questions. I believe you have had answers to some of the yearning questions perhaps you wanted to know, especially as they affect public health care in our country. I am Adetu Eshishitu Alamo. I appreciate your being there, and I thank you for watching. Goodbye until we see you next Monday. So long.